Welcome. My name is Pam McElvain. I am your host this morning, the CEO of Diversity MBA Media for the DEI Best Practice Sharing. I am so excited to have with me the Street Diversity Officer for Fernando Little from Atrium Health, and he'll go into it a lot more. But good morning, Fernando.
Good morning, Pam McElvain. You know, this has been the highlight of my week to always have conversation with you and Diversity MBA. So glad to be here, and we certainly appreciate the invitation on behalf of Atrium Health, now part of Advocate Health.
Oh, excellent. Thank you so much for sharing that. I wanted to, one of the things I ask, I know we're in this new normal and I know people are, heavily engaged in different things, but I have to ask you, with your schedule, how do you keep yourself well, both mentally and physically?
Yeah, thank you for that question, because self-care right now is so important. And please understand that I tie my self-care into being a dad. So I have two boys, they are 16 and 20, and I have to convince my wife they're not our babies anymore, but they are still a reflection of my best self, of who I am, and me, the more I pour into them, the more they make me proud, in terms of who they are and their work ethic and their resolve and how hard that they work. So I have to prioritize and preserve my time with them. Whether it's, going to travel, Pam, I'm traveling the world with travel basketball, right? They both want to be the next LeBron James or Steph Curry, but they also are scholar athletes. They do well in school. And so I want to make sure that, I'm supporting their progress there. And then, so my wellness is directly connected to being the best dad I can be, and being the best husband that I can be, and the best son that I can be to my family. And you've got to protect that quality time. So as things, compound and your time gets tugged on, you still got to be intentional around protecting that quality time. So that's one thing that I do. I pour into myself. Music is an outlet for me, right? And so whenever I can escape and be able to play the music. I play the piano, so I have the opportunity to do that with my church every week, and I don't make it my full-time job because it is an outlet for me, and I want it to remain an outlet. I don't want it to feel like a job. And then the last thing I'll say to keep myself well is you have to stay emotionally connected to whom you're impacting in this work. Because I think you got to find a source of discretionary energy, because there are other things that come around, like the fatigue factor with long hours, and you're dealing with unproductive distractions, and you're dealing with nagging microaggressions from other people, right? And so sometimes that pulls on your energy level, right? And you got to find discretionary energy to go above and beyond. And my discretionary energy, Pam, comes from staying connected to the meaningful work that we're doing, whom we're helping, and knowing that we're helping the people that need it the most. That's what gives me my energy, and that's what keeps me going. So I just wanted to share those things, as nuggets for Fernando. That's what keeps Fernando going.
I'm sitting here wanting to say, amen, preach, because absolutely. And I know people are going to take from that. And I love the way that you did, talk about, hey, this is, how I'm self-caring, being inclusive with my family, and that people can see that as time, for themselves. So I appreciate, and I also appreciate you sharing and pouring into, for the practitioners to know what they need to do and how to pull forward. And I will say this to you, that share this with you, that I know proverb said that self-interest is not a negative thing. Self-interest is a necessary thing.
Absolutely.
If you're not taking care of yourself, you can't care for others.
That's right.
People need to do more of that. All righty. Well, hey, thank you so much for that. Let's get into this. There's so much here, and I'm like, I know we're not going to be able to get all of it, but you definitely can expound on some of it as you answer. But in talking about health equity, one of the things that has been amazing is the intentional leadership and efforts that Atrium Health has made significant changes and to your strategies and saying, this is what we need to do. It's necessary for us to do. So we're leaning into this work a lot. So not just talk about best practices, but maybe a few of the key strategies that has fostered that Atrium Health has done that has, one, I would say, impacted your workforce and then has fostered into the community. So how health equity, in terms of the strategies that you guys have developed, are impacting your workforce and are spilling over into the community?
Yeah, so this is an opportunity and a critical strategy for us, but this is also where we're thankful for platforms like Diversity MBA that have prioritized the conversation and have given us, an outlet to really socialize that diversity, equity, and inclusion is a pathway to health equity. And the strategies that you espouse, Pam, through your media company and your partners, your learning partners, the strategies that come from my office each and every day are strategies that are directly connected to us realizing how to manage health equity. And so, for example, one of the intentional strategies at Atrium Health that has helped is building a blueprint around social impact and understanding how diversity, equity, and inclusion is a driver for addressing those social determinants and the social impact. And this is an example I always give, Pam. So you were recently in Charlotte, you and your team, and we were probably about 4 blocks from the inner city when we came together, and right from where we were is our HBCU, the only HBCU in Charlotte, right? Johnson C. Smith University. It's in the Biddle Point community of Charlotte, right? And so that is a fixture for our city, and it's the center point of our city. So 6 miles from Johnson C. Smith University is Myers Park community, right? 6 miles. A more affluent community it's about 3 blocks from where our flagship hospital is. 6 miles from the zip code of Biddle Point, where Johnson C. Smith is. We, in our data point and our geosensing technology, realize that there is a 16-year difference in life expectancy in those 2 zip codes. It should not be that much of a difference. 2 zip codes 6 miles apart in the same city, but a 16-year difference in life expectancy. Pam, zip code should not be a greater predictor of your life expectancy than your DNA, right? And so we, as part of our social impact strategy, we've said we're going to make a concerted effort to close that life expectancy gap by intentionally addressing the social determinants of health and some of the acute social needs, which, here's another thing, Pam, 80% of that impact happens outside of the hospital. Go figure that, right? So 20% of your health and wellness comes from an expert clinical team, your diagnosis, your medication regimen, making sure that you have what you need, for that healing process. But 80% of it, Pam, happens outside of the hospital. And we have to have a collective responsibility to address those acute social needs like meaningful employment, access to care, transportation, food insecurity, making sure you have access to healthy food and things of that nature. So housing, affordable housing, my word, if you're discharged from the hospital and you go somewhere where you barely have some type of virtual internet connection or a telephone or some type of air and heat. So those are all part of an acute social needs, social impact blueprint that Atrium Health has intentionally embedded into our infrastructure, into our systems, so that we know how to impact that and your health and wellness inside and outside the hospital.
I just have to applaud you and say, unfortunately, the zip code issue is not unique to Charlotte, but it's an urban city collective issue. And so around the country, this should be a blueprint that every organization, I know, I will tell you, in Chicago, I went over to the West Side for an event with the healthcare system that serves the zip code, and like you said, 16 miles. 16 years because of a zip code. My zip code where I live and the zip code where I was visiting, it was overwhelming because we don't see it every day. We don't think about it, but you know about it. So what you just really talked about is a global strategy that we have to really get out there and say what's great. What I love is that, you guys are bringing those strategies, with Advocate Health into Chicago. So I know it's going to happen here, but we have got to be more intentional about that. So that is incredible. So, one of the things in staying with the equity conversation, you mentioned in our earlier talks, career equity. Yeah. So talk a little bit about that, because I'm fascinated that you use that word. And I'm like, oh my goodness, yes, that is really what's happening. I know someone else probably framed it, but I'm gonna take it from you. I'm gonna give it to where I heard it from. And so, talk to us about career equity from your perspective, and what you also see as the opportunities there.
Yeah, Pam, I got to come pretty strong on this one, because I think if we're going to talk about career equity, we've got to be courageous enough to say that as it stands right now, the pathway for people of color in corporate America looks tremendously different than the pathways and the sponsorship of people from a majority demographic. And that has got to change. And I don't know if there's just not an awareness of that, or if there's a blind spot to it, or if there is just, a bystander apathetic approach to it. Like, well, we see it, but we don't know what to do about it. And so the first thing is being courageous enough to say that the pathway does look different, and there needs to be something interrupted structurally in terms of what's in the ground to prevent that. And then you got to be courageous enough to call that out. And I'm thankful that I work for an organization that's allowing myself and my team to be courageous enough to say the pathway, for example, for women of color in the organization does not look like the pathway for some of our other demographic groups that are not underrepresented. So we need resources to uncover what are those hurdles for the women of color in the workplace. What are those systemic challenges? And so we partnered with consulting organizations like yourself and others to really identify what are those major hurdles for women of color in the organization. And then what we have done is we've curated a whole leadership development program around those hurdles, so that we have a systemic and practical way for addressing those hurdles. And then, so if it's from a policy perspective, then we've got to have a work stream that's looking at policies to make sure that our hiring and our talent development is inclusive, right? If it is from a sponsorship perspective, we got to make sure that we have sponsors that are willing to block and tackle for these women that are super talented, that are well educated. Because Pam, it's not a deficit in education. It's not a deficit in experience. It's not even a deficit in performance. It is just more around sponsorship. It's more around making sure that, our intentionality around talent development is there. And so I'm very proud of the Aspire Women of Color Leadership Academy. We just graduated the first cohort. They graduate now with sponsors in the organization that will help them navigate those hurdles, help them get that stretch assignment, help them be brought up in talent calibration discussions that maybe before would have never occurred because there was not that connection or there was not that exposure to the program. So, career equity is two things, really. It's having the courage to say that the pathway has been different for some of our underrepresented groups. But then two, it is what is the transformative equity approach that you're willing to do to interrupt what's causing some of those barriers, right? And then you gotta put all of that bring all of that together. So the career equity discussion is something I'm very passionate about, something that I'm very, very thankful that at least I have an avenue and a pathway through Atrium Health to address it.
You know, you hit on everything around why it's not happening. I think it's incredible. It's imperative the way you have structured, you know, in terms of being really intentional. The sponsorships, you know, exposure and access are the two major things that women of color don't have. Black women particularly, but also, you know, other groups, but particularly Black women are overqualified than any other group, and are matriculating at a higher rate than any other group relative to the percentage. So it is, you know, something that on a global scale organizations need to look at. Our numbers are showing that it's declined. It's because this group, they do not have sponsors as a matter of routine. And then even creating mentoring programs, you know, at the senior manager and director level that prepares for access and exposure and sponsorship is the deep dive that organizations are going to have to do, and and accelerate these groups. So you're absolutely right.
And Pam, you're spot on too. You're spot on too, because that's the next level of our Aspire Leadership Academy, is to cascade it to the next level in the organization, the director and the manager level, because those are the talent pools, and we call them feeder pools that feed into the executive ranks. We wanted to intentionally start with the cohort that's right there, ready now to be promoted into the executive level of our organization. So that was the first cohort that we started with. But to your point, and you called it out precisely, and I hope Gene is listening, because if you say it, then he might do it. Then no, he will. We've got full support from Gene and both of our CEOs, Jim Scottsboro as well. But the next level is cascading it down to that director and manager level so that we can sustain a feeder pool. And then what does that say, Pam? There's intentionality with that. This is not a moment, it's a movement. Right?
Absolutely.
And if you ask me, it should be more than a movement, it should be a directive. You know, we've gone from being a moment to a movement, that it should be a directive, you know? And so that's the next, I'm glad you called that out. That's the next step for us in that program is cascading it to what does this look like at the director level, at the manager level.
Yeah, you know, and I'm just gonna put the plug in there, and that's why you are our #1 company. I mean, you know, for 22.
Right, 22, right.
That's I was asking for 23, but I'm saying that's why you won the top. I mean, that is why, because of this work. So I'm just going to throw this out here real quickly. Wasn't supposed to do this, but I just kind of have to go here. Just want to just hear really what your thoughts on around this. You know, with the human rights issues under attack. And I have some point, you know, in my efforts to, people are asking, you know, what do you want CEOs to do, Pam? What should we do? You know, and I'm saying just stay true to your path, stay true to your mission, stay true to your work. But what have you seen and heard within your organization? And if anything, what are you guys doing to ensure that, you know, the LGBTQ, you know, IA non-binary community feels safe, like both psychologically as well as physically in coming to work and within the community and within the workplace?
It's an incredible question and an important question, Pam. And again, what I can stand firmly on is we don't have to be subjected to political pandering in this space, because we have a mission that says health, hope, and healing for all. For all. And we take those two words, Pam, and we run with it. And that means that regardless of your demographic, regardless of your sexual orientation, regardless of you know, whatever underrepresented group or overrepresented group you're a part of, we have an obligation to care for you, first of all, to care for you. And so we have even prioritized what our LGBTQ plus care delivery model looks like to make sure that, one, you know that you can seek healthcare in our organizations in a safe place, and you can be met where you are in terms of your LGBTQ journey from a healthcare perspective, right? So that's first and foremost. And then in terms of supporting a culture of inclusion and belongingness, that is definitely a priority for us. So we have a resource group for our LGBTQ teammates. We're just about to have a celebration and acknowledgement of Pride Month next month. In terms of consumerism, Pam, you've got to be able to elevate the voice of emerging populations and interest groups in your organization, because it's the right thing to do from a consumerism standpoint, but from our mission, from a health, hope, and healing perspective, is absolutely the right thing to do. And so we have a care delivery approach to it, but we also have a culture of inclusion and culture coalition approach to it as well, because we believe that your experience and your engagement in the workplace makes us an employer of choice. And thankfully, Diversity MBA sees it that way. We have some other organizations that see it that way. And what's affirmation for me is a lot of times we're close to the work because we're passionate about it, and we want to drive inclusion, we want to drive belongingness. But when teammates are asked or solicited about their experience without us asking, and they give an affirmative response, yes, I feel like my voice is amplified, yes, my voice, that's even more validation for us that this is not window dressing. It goes deeper into the organization, and it's really touching our organization. So we're doing our work with the HEI index, the Health Equity Index, and going to submit for that. We fully expect to be in the top percentile of that from a human rights campaign standpoint. But from a care delivery perspective, that's an ultimate priority for us right now as well.
Very well said, and I appreciate that, because what you are saying is at least your workforce, and that spills over into the community, because they become the community when they leave work, is they have a place to find safety and to be able to secure help if they need it as a resource. So that was really important. I love that, the health, hope, and healing for all, because now you're talking human equity. You've
Yes.
gone on to human equity, and we've eliminated race. I always say it's a zero-sum game when you're talking about all groups, because everybody has their experiences with differences and need to have a place to come together, respecting each other. So I appreciate Atrium, for that vision and that work. Just shifting the conversation a little bit over, because some folks just wanted to hear about your system, your system resource groups, and how successful you guys have been in supporting them and allowing them to be business collaborators and innovators and contributors within your organization. So you might talk a little bit about that.
Yeah, and so you just said it, the latter part of what you just said, how do we set them up to be business collaborators, innovators? And that means that they've got to stay connected to the business, and we are their liaison to the business, right? And so we've got to make sure that our SRGs know what our business imperatives are, what our organizational scorecard looks like, and then what our strategic DE&I agenda looks like, which is connected to the organizational scorecard, right? If we're not transparent with sharing that information with them, then they're not able to organize their areas of focus around it, right? So I give you an example. Social impact and health equity, we just talked about it. You heard how passionate we are with it. We share that with our SRG groups or resource groups, which are primarily organized around affinity, right? And so our Latino and Hispanic group, Unidos, picked up on there was an opportunity to mobilize around colorectal screening in Hispanic males, right? And they said, that's something we can take and run with. So what's the campaign for that? How are we socializing with that? How can we get in the community and make sure that the community, one, knows that there's a trust factor there? This isn't about inviting you in so we can see whether you're documented or not. Has nothing to do with that. Has nothing to do with, us trying to help the government with your immigration status, or it's none of that. It's more so about the health and wellness of this community, and the community hearing that from Unidos. They could meet them where they were, help with that trust factor. And Pam, within a year, we saw that disparity, that particular outcome improve by 70%, because they said, we want to help with that. We want to help with that. We can help you in terms of the outreach to the community. And so engaging the resource groups in a meaningful way, keeping them connected to outcomes, but also giving them a voice in recruitment. Whenever there are hard to fill positions and we have an underrepresented demographic in a certain area, we go to our resource groups. We say, how do we cast a wider net here? For professional development and mentoring, you even said it, Pam, earlier, mentorship is incredibly important. SRGs can be a strong foundation to building a mentor program within your organization. A lot of our mentors are our strongest mentoring programs, Pam, live in our resource group. One of our strongest programs is within our Women's Executive Leadership Group. They have a very strong mentoring program within there. Our Men's Diversity Leadership Network, very strong mentoring program within there. So resource groups are a very, very strong unit for that. And then, we just talked about the community engagement. There's tremendous opportunities for impact in the community with our resource groups. But I would say to stay relevant and next level work in this space is more than, and Pam, I don't even like this statement. Every time I hear it, it cringes me. But when I hear Taco Tuesday, it's like, it's way more than Taco Tuesday, right? You know what I'm saying?
It really is. Let's get over that.
Let's get over that. You know what I'm saying? It's more about the impact that you make in your community and to your business, and the important obligation for offices of diversity, equity, and inclusion and diversity practitioners is to make sure they're connected to the business objective. Make sure that they're connected to what the organizational scorecard says.
Yeah, and I want to just ask you, I didn't want to interrupt you. I was like, okay, Pam, I'm hijacking. But I wanted to ask you, so that is, for a mature organization and the work that you guys have, I mean, you're talking about 70% impact from a ERG, launching and managing and sustaining mentorship programs, engagement in the hiring process. I mean, these are just incredible initiatives. So we get a lot of questions, and there's quite a bit of this going on in the marketplace where organizations are trying to one re-engage their workforce to become members within their ERGs, and two is they're launching your system resource groups or employee resource groups. They're launching them. What advice, a couple things, just a couple nuggets, what advice would you give organizations that are trying to either create new employee resource groups and or relaunch them for reconnection within the workplace? I just wanted to stay there a little bit and have them hear that from you.
Yeah, so the priority rests in, do you want to win in the talent market? And if you want to win in the talent market, you have to understand that employers of choice understand that candidates want to work for an organization that prioritizes inclusion and prioritizes belongingness and prioritizes an environment that uplifts culture commitment to culture, and that their voice is going to be able to drive what those culture commitments are. So the value proposition, Pam, for organizations is, if you want to win in the talent market, you've got to have a robust DE&I strategy. There are too many data points out there. You can go to Glassdoor right now and see, what are the candidates on Glassdoor looking for in an organization? And I promise you, one of the top things they're looking for is diversity, equity, and inclusion. You can go out and look at the most recent McKinsey study that says, employers of choice, how do you recruit the top and the best candidates that are out there? The candidates are looking for a strong DE&I strategy, a long-term DE&I strategy. So if you want to win in the talent market, you've got to show that you prioritize it. And then having a diverse talent base in your organization just increases your level of innovation, your level of product development in terms of new product development, ideation, all of that. There are just too many results that show high performing companies that have prioritized this. So a lot of, and Pam, you and I know that we will always need a business case for DE&I. Some people are telling me, Fernando, why do we still need a business case for DE&I? Because it goes back to your question earlier around human kindness and humanness. This is a humanistic issue. So why do you even need a business case? But we will always work on having a business case, but the business case always shows that there's a correlation between high performing companies and how they prioritize DE&I. So that's the value proposition.
So you're saying, so really, if you're going to create an ERG without a credible DEI strategy, then you're just kidding yourself.
You're kidding yourself. Right?
The DIG is the ERGs are they're the champions to help with the execution of the work.
And they drive what I call your culture coalition. So they pretty much help to shape the culture commitments of your organization and ensure that what you want to be known for in terms of your value systems, the commitments of your culture, they help you to shape that.
And if you and they are the idea is that they're the representative voice of your workforce. And if you are going to listen to anyone, you're going to listen to them and then allow them the space to activate as you did with the Latino group and have impact to say, oh, this is impacting our community directly. Yes. So we want to do and be a part of that outreach, not because of Taco Tuesdays, right? And we understand that we can make those from scratch, but because we understand the idiosyncrasies within our culture. We understand what we need to do to reach certain groups within the culture. And so I appreciate, this discussion because I think folks don't understand them.
Absolutely. And if I could add in one more thing before, because our conversations move so quickly, and I just want to make sure I get this in. There is an evolving data point that shows, and your research team probably followed this too, that when ERGs are managed effectively, there's a direct correlation to teammate engagement, right? And in your engagement, then is tied to productivity, is tied to attrition and retention and some other things that save you money, right? But there is also, and this is something that diversity practitioners need to pay attention to. I'm asking my team to do it, is let's capture those elements that show the ROI from the SRG. So let's capture, for those that are actively involved in an SRG, what is the retention rate within that group? What's the promotion rate within that group? What's the engagement factor within that group? Because I'm very, very optimistic that we'll see a differentiated result from that.
Thank you so much for doing that. We actually have identified the top 10 things that resource groups do, particularly system resource groups, employee resource groups, the name that organization they choose to call them, identify what those are. And you're absolutely right. We know that they actually impact these, but understanding what it is, I mean, that is, you're basically, unfortunately, doing a leading practice, and we ask companies about that all the time. And they're like, well, we haven't segmented it from this or that. And, and now to do that, because there's the case once again, right? There's the business case once again, and for managers to do it. So thank you for that, because that is, what informing, right? Creating informed decisions. So I know we're getting here to time, and it's been some great conversation, which I knew you would bring forward, but just a couple more questions. I wanted to ask. So I wanted to, your perspective, kind of now I'm going back to the industry, going back to the healthcare industry. overall in terms of how you see the industry moving in health equity since the pandemic? Do you see that? Do you feel that it's been stagnant? Has it gotten better? And I know Atrium has taken some very specific initiatives, as you've spoken about earlier, to do some things differently. But
Right.
holistically, you know, what is your perspective on what's next?
Yeah. So Pam, this is scary because sometimes I think you're in my head, because I wanted to go back to this for a quick minute because there was a couple things that I wanted to say and you went back to it. So I don't know if that's good or bad that I feel like Pam is in my head. I don't know, but so the pandemic, Pam, was a real time gut check for us in terms of the disparities that we're facing. Right? Because when you think about the comorbidities that we have in our communities, the pre-existing conditions, that exasperated the disparate impact that we saw on COVID in communities of color, right? And it was right there in our face, right? And so what I will say in terms of what I'm seeing in the healthcare industry is an elevated awareness around the need for a collaborative effort around this, you know, especially the pandemic did say. So when you think about state agencies, like I'm on one of our North Carolina Healthcare Association state agencies for health equity, right? And there's the governor of the state of North Carolina said, we've got to come together. The most powerful healthcare institutions in North Carolina have got to come together and work together to create, you used the term blueprint earlier, for other organizations that don't know how to mobilize around this, that don't know how to create an infrastructure around this. What's the blueprint, right? And so what I'm optimistic about is there is a more accelerated collective effort around this. What I will say that Atrium is doing to stay as a leader in this space is we are standing up, Pam, what we call a National Center for Health Equity. And in that model, it's a 3-pillared model. The first pillar is intentionally incubating solutions around the most prevalent disparities in our community. So there's got to be a business model that incubates solutions that address the most prevalent disparities, right? So that's clinical teams, our best world-class physicians, our researchers, healthcare researchers coming up with those solutions, right? Then you got to have a pillar of operations in this center that can socialize those solutions, you know, in the community. How do you get the community engaged? How do you get the right demographic audience? How do you make sure that there's a trust factor around whatever the solution is, right? So that then there's that part of the model. And then sometimes we forget about this, but then how do you assess and evaluate whatever it was you put out there? Did it work? Did you get the ROI on it? And then if you did, then guess what? You scale it. You scale it and make it a broader reach, right? If you don't get the clinical outcomes that you want, you go back to the drawing board and you get back over. The fact that Atrium Health, now part of Advocate Health, is building a center with this type of model is, I believe, going to be a game changer in terms of health equity and reducing the disparities that we see. So that's something that I was excited about, and I wanted to have a chance to mention that.
No, and that's huge, and that's exactly what I wanted to hear was, you know, what are some of the game changing? What is the next level? If it doesn't exist, we need to go create it.
Let's create it.
And that, to me, is the responsibility
Yes.
of greatest organizations in our nation, is that you have to go create it. If you want HBC talent and they don't have the infrastructure to develop, invest in it so that you build out your talent so that you can get the other group, though, and I know we're going to get down, but the other group, what I call the outliers, those that are homeless, those that are coming out of the prisons back into the transitioning back into the communities. We do this for veterans, as we should, and we should even be better for our veterans, but our persons with disabilities. And I call those the outliers because they still are not as part of mainstream as they should be. Will your center And are the organization health organ, and I am talking about healthcare right now, because healthcare thinks wraparound because of the social detriments. You guys come into
Yes.
a holistic approach.
Right.
So I was, the last question on this, but I just want to know how have you thought about, and I call them outliers because they really are, but these
Yep.
outlying groups that are huge in our population and that have to be, again, a part of at least the mainstream, no matter where they fit into it. But we've got to fix that somehow.
Absolutely. And Pam, my short answer to that is that's why diversity MBA is part of that pillar, that second pillar around socializing these solutions. It's really prioritizing stakeholder partnerships like we have with you, longstanding partnerships, so that we can think about those outliers and develop those strategies for the outliers. One comes to mind is our Restorative Pathways program, where we've started working with justice involved citizens that are coming back into the workforce, and making sure that there is a cohort for them and a career pathway so that they have meaningful employment and access to care. But partners like yourself will help us to develop and broaden those strategies with some of those outliers, because they're absolutely part of who we want to reach in the Health Equity Center.
So with that, I am going to say, oh my goodness, what an incredible conversation and just thought leadership approach that you have. I mean, we are so elated to have had you take this time to share with us. And I will tell you, I've just, in my mind here, I just said, you know what, we're just going to have to put it out this bigger than this. We've got to share, actually as much as we can with the world, with our ability to reach millions,
Yes.
on radio, media, this story, because it's so huge. So congratulations.
Thank you, Pam.
To you and your team, and thank you once again.
Thank you so much.